Hello and welcome back to certification review. We are going to get started on certification review session number 5. If I can get my PowerPoint up, we can get started. Okay. All right. Just to review, there is always a packet to accompany our certification review sessions. We're on number 5, so please go to Blackboard, into the Student Resources folder, into the Certification Review Sessions folder, and locate the Cert Review Session 5 questions. Make sure you have it printed out or downloaded onto another device so that you can participate and follow along with today's lesson. Back at it again with our test taking strategies. We are going to continue practicing these throughout Practicum 1 and 2. This is for your benefit. So just a quick recap. Step number 1 is going to be read the question in its entirety. Try to read this as slowly as possible, digest it, take a deep breath, and then do your best to answer it in your head before you look at A, B, C, and D. So first, read the question in its entirety. Second step is read it again, and I mean it. Make sure that you understand what the question is asking. Remember to identify any of those key words. Third step is to discard 2 of your options from A, B, C, and D using your process of elimination. Try to identify the answers that are listed that do not fit what the question is asking. That way you can get down to a 50-50. That is going to be statistically a better shot of you answering the question correctly. Even if you're guessing, it's a better shot at guessing correctly. And then last but not least, answer your question with confidence. If the answer in your head matched the options that you have left in your 50-50, go with it. Do not second guess yourself. Go with your gut. You've already done your test taking strategies and you've gotten to this point. You should be able to trust your instincts. Do not go back and change your answer. The only exception for changing your answer is if further down the line you have this sudden realization that you either misunderstood the question, or if you're further through the exam and you receive another question that's similar or pertaining to the same topic and it jars your memory, then go back and review it. But if you are going to go back and review a question, make sure you don't just change your answer and move on. Go back to that question, do your test taking strategies again, read the question, read it again, do your 50-50, and really digest and make sure that if you are going to change your answer because of this aha moment, that you're doing it for the right reason, not because you're second guessing yourself, but because you had an epiphany. Okay, so that's your test taking strategies. Please stick to them. They will help you score higher in the certification exam. Okay, our learning objectives for this week is going to be ENT surgery, anatomy and physiology, ENT surgery intraoperative procedures, and then administration and personnel is going to be our last category. Okay, so for the anatomy and physiology review, I'm going to exit out of presentation mode. Just like always, I'm going to zoom in so we can do this together. Okay. Question goes, which ossicle of the middle ear is embedded in the medial surface of the tympanic membrane? Now, there's a lot to digest just in the text of the question alone. There are a lot of medical terms. There are instances of talking about directionality, and they are talking about location as well. So we want to make sure we kind of pick apart this question and digest the entire thing. So I'm going to think about it in my head. And then I'm going to read the question again. And when I read the question the second time, I want you to come with me on this journey. We're going to really pick apart this question, make sure that we understand what's going on. So at the beginning of the question, it says, which ossicle? I'm going to stop right there. And I want to ask myself, what is an ossicle? From class, if you remember in the ENT chapter of the book or in lecture, if you can kind of picture that, the ossicles are the bones in the middle ear. I'm going to pose this question to you. Hopefully you're able to answer it in your head. if you remember how many ossicles there are in the ear, think about it. How many ossicles are in the middle ear? I want you to answer it in your head. Hopefully the answer matches mine. There are 3 ossicles in the middle ear. Now, they're talking about the malleus, incus, or stapes. Those are the 3 ossicles in the middle ear. Okay, I always remember it as MIS, kind of like minimally invasive surgery. That's how I remember the 3 ossicles of the middle ear. Hopefully that helps somebody. So malleus, incus, and stapes. Now, just for, and I'm not even looking at A, B, C, and D. I'm trying not to even look at it right now on my screen. When I talk about the malleus, incus, and stapes, I always still want to, to refer to them as their given names, and then I also want to know their like nicknames or their pseudonyms. So the malleus, incus, stapes, the malleus is sometimes referred to as the hammer. The incus is often referred to as the anvil, and then the stapes is often referred to as the stirrup. So we have the malleus, incus, stapes, or the hammer, the anvil, and the stirrup. Okay, so this is what I mean by picking apart the question. I want to make sure that you really dig deep into the anatomy and physiology, the med terms that are in the question. This is for 2 things: to make sure you understand the question in its entirety. It also might jog your memory a little bit, kind of put yourself back in either the classroom or even in your own study space, trying to remember exactly where and when you were learning about this topic. It might help to really give you a clearer picture and a clearer memory of this information. So that's why we do this. I'm going to continue. Which ossicle of the middle ear? I'm going to stop right there again. There are 3 sections to the ear. The external ear, essentially everything that you can see and touch on the outside of the ear, that's the external ear. The middle ear is where we are, which is where the 3 ossicles are. There are a couple other structures as well. The external ear and the middle ear are separated by the eardrum or the tympanic membrane. And then there's the 3rd section of the ear, which is called the inner ear. And that is going to be where the processes of hearing and balance are really located. Some of the structures, some, but not all of the structures of the inner ear are the cochlea, the vestibule, and the semicircular canals. That's kind of the structures that we're talking about, the location of the inner ear. Again, this is trying to put me back in the headspace of where and when did I learn about this and how much information do I still have. So when we're talking about the middle ear, I'm talking about the section that is a completely air-filled chamber that has those 3 bones of the inner ear. The middle ear. See, I need to make sure that I go slow. And the middle ear's job, a lot of the purpose of the ossicles inside the middle ear is to conduct the vibrations of the sound waves that hit the tympanic membrane and conduct that pattern or those vibrations through the bones of the middle ear and send those into the inner ear so that we can process that vibration or that external stimulus as sound. So that's what the middle ear ossicles are doing. They are conducting the sound waves from the eardrum into the inner ear. Okay, and now they're asking about the medial surface of the tympanic membrane. Now, medial versus lateral. Medial is going to be more midline. That's sometimes we refer to the medial as the midline. Lateral means away from the midline. So I'm trying to think of the external, middle, and inner ear, and I'm thinking especially between the external and the middle ear, where the tympanic membrane sits and which way is lateral and which way is medial. Okay, so medial would be kind of further in towards the center of the body. Want to make sure you know the difference between medial and lateral, superior versus inferior, proximal versus distal. Those terms are going to come in really handy when attempting to answer a question like this. And then again, remembering that the tympanic membrane is the medical term to describe the eardrum, and that is going to specifically separate the external and the middle ear. Okay, that was a lot to digest. Sorry for all of that, but it is going to come into play when we get into our answer. So I have read the question once. I talked about it to myself, thought about it in my head. I answered it in my head. I'm gonna wait for that for you guys. And then I read it again and I really digested it. I really picked that question apart. Now what we have to do is get into our 50-50. So the possible answers, we've got A is incus, B is malleus, C is pinna, and D is stapes. Obviously, we talked about how there are 3 ossicles, 3 bones in the middle ear, and there's 4 responses. So we got to figure out which one is not like the others. So we talked about MIS, malleus, incus, stapes. Pinna is going to be my first elimination because it is not one of the ossicles of the middle ear. Okay. If anyone's wondering, the pinna is another word for the actual physical external ear, the part that you can physically touch. This entire piece of the ear, outer surface of the ear, that's called the pinna. Sometimes also referred to as the auricle, A-U-R-I-C-L-E. Okay, so we have malleus, incus, stapes. Now, the reason I always say MIS or malleus, incus, stapes is because it is in a progression from most lateral to most medial. And remembering that the lateral segment in that chain is going to be closer to the tympanic membrane because the tympanic membrane is kind of the start of the chain, and we need to be locating a bone or responding to this question, figuring out which bone is embedded in the surface of the tympanic membrane. So the further away you get from the tympanic membrane, we're not going to be close to answering this question. So that was a lot of words, gonna go slow. So when I think of the middle ear, I think of from left to right or from lateral to medial. The tympanic membrane kind of starts the chamber of the middle ear because it separates the external and the middle ear. So the tympanic membrane, and then we have MIS, malleus, incus, stapes. So the stapes is furthest away from the tympanic membrane, so I'm gonna get rid of that because I know that the stapes has nothing to do with the tympanic membrane. It is nearest the structures of the inner ear. It's actually going to be sitting over that window, the oval window. So I'm going to get rid of it. And then I've got my 50-50. I've got incus and malleus. And because I have this moniker, this MIS, I know that the malleus is right there next to the tympanic membrane. So I'm going to go with that as my answer. And then I'm going to go back into presenter mode so you guys can see it is malleus. And you can see the reason they call the malleus the hammer. Goodness, can I find my cursor? Okay. The reason that they call this the hammer or the mallet is because it kind of looks like a hammer or a mallet. So the actual handle of the malleus is embedded in the medial surface of the tympanic membrane. So if you've ever heard of someone perforating their eardrum with like a Q-tip, that's the lateral side. Where's my darn cursor? Okay, so say that a little kid accidentally perforates their eardrum with a Q-tip. The Q-tip would be coming from the lateral aspect of the tympanic membrane and pushing. So that this is the lateral side. This little canal here that you see that's kind of fading away is the external auditory canal that you can actually introduce something like a Q-tip or an instrument into. So this is the external auditory canal. This is the lateral surface of the tympanic membrane right here. And then this is the medial surface of the tympanic membrane. And you can literally see the malleus's handle is embedded in it. So every time the tympanic membrane receives external auditory stimuli, it's going to vibrate, and that will vibrate the malleus. And then the malleus is joined to the incus by an actual joint, yes. That will vibrate the incus will vibrate the stapes, and then the stapes will vibrate over this oval window and send that pattern or stimuli into the cochlea for hearing. Okay, that was a lot of information, but hopefully that helped in contextualizing where we are with the test taking strategies. Okay, now I want this to be continued on your end. So please answer numbers 2 through 15 of the ENT anatomy and physiology section using these test taking strategies. So when I say pause, please hit the pause button on your video player, answer numbers 2 through 15 on your own. When you have completed that section, please hit play and we will answer the questions together. Okay, on the count of 3, 1, 2, 3, pause. Welcome back. Okay, we're going to go through these answers. I'm going to give you a little bit of tips here and there as far as the anatomy and physiology, but we're mainly going to review the answers here. Okay, number 2. Which laryngeal cartilage functions to prevent food and liquid from entering the trachea? That answer is the epiglottis. And if you download the PowerPoint on your own, I have a really short little itty bitty video, but it shows an image of a sagittal section of a person swallowing, and you can literally see the epiglottis kind of folding over every time the patient swallows so that the food does not go down the windpipe, it goes down what I like to call the food tube. So it goes down the esophagus. Number 3, the eustachian tube is located between which two structures? That answer here is going to be B, the nasopharynx and the middle ear. You can see in this image that I've attached the actual infant and adult images. Now you can see sometimes why infants tend to get middle ear infections because their eustachian tube is a little bit more horizontal, whereas in an adult, it's about at like a 45-degree slope, so the middle ear can drain a little bit easier. So that's why little kids tend to get middle ear infections often. Okay, number 4, which of the following nerves is responsible for coordination, equilibrium, and balance? And that answer is going to be C, the vestibular branch of cranial nerve number 8. Make sure you review your Roman numerals because those can get tricky. Number 5, the septal cartilage has bony attachments to which two facial bones? That's going to be your ethmoid and vomer. Here's an image of what it looks like. You can see here I guess number 6 in the image, this is the vomer. And you can see the attachment to the quadrilateral or septal cartilage here. This blue is the septum. So here's the vomer. And then here, this number 7 on the image, this is the ethmoid bone. So you can see its connection to the cartilage there, the septum. Okay. Number 6, conduction type deafness may be the result of a pathology called otosclerosis. That means an abnormal bone growth causing the ossicles to fuse. And you can see here most of the time the otosclerosis happens at the stapes foot plate, and it can actually overgrow and fuse to that oval window, causing that deafness. Okay. Number 7, 3 pairs of bony projections protruding from the lateral walls of the nasal cavity are called the conchae. Sometimes they're also referred to as the turbinates. Number 8, the root of the facial nerve runs directly through which gland? This is the parotid gland. And you can see the image here, this very large salivary gland, the parotid gland, this is the facial nerve that runs through it. Okay, so whenever we're doing a parotidectomy, we have to be careful. Okay, number 9, the true vocal cords are located in which segment of the larynx? This is the glottis. The actual glottis is where the vocal cords sit. And the word glottis actually means an opening. So the actual vocal cords are going to be opening and closing at the glottis. That's going to be creating that opening of the glottis. Number 10, which pair of tonsils are called the adenoids when they become enlarged? Those are the pharyngeal tonsils. Number 11, which paranasal sinus is located within the upper jawbone? That's the maxillary sinus. And you can see here, it almost looks like a Rorschach ink blot test. You can see the maxillary sinuses in the maxillary bone, the upper jaw. Good. Number 12, where would a gingival buccal incision be made? And this is where the gum meets the cheek. You need to use your med term here. Gingivo means gum, buccal means cheek. And then that would be where our incision is. Number 13, the thyroid gland produces hormones that are responsible for the regulation of which mineral in the bloodstream? This is calcium. Number 14, which laryngeal cartilage is the only closed ring of the upper airway? That's the cricoid cartilage. And number 15, what is the medical term for the groove that extends from the upper lip to the nose? And that is called the philtrum. All right, so now we're going to switch gears into the intraoperative procedures of ENT. I want you to use this time to answer questions number 1 through 15 on your own using our test taking strategies. Again, just like always, when I say pause, please hit the pause button on your player, answer the questions on your own, and then when you have completed that, please press play, and then we will review the answers together. On the count of 3, 1, 2, 3, pause. Okay, welcome back. Number 1, which surgical procedure will be performed to treat cancer of the tongue? That is a glossectomy. Glosso means tongue. Ectomy means removal. Number 2, which of the following instruments will be necessary to perform a mastoidectomy? Here you're going to need a power drill. Sometimes that power drill is known as the Midas Rex. That is one of the more commonly used power drills in ENT. Just for a little tip there, Midas Rex. Okay, number 3, which procedure would most likely be performed for drainage of an abscess in the base of the maxillary sinus? And I showed you an image of this incision, the gingivobuccal incision. That is called a Caldwell-Luck procedure. And that is going to be that gingivobuccal incision to get to the maxillary sinus. Okay, number 4, which of the following is a type of tracheostomy tube? This is called a Shiley. So this is what the image of the Shiley looks like. It's one of the more popular models. It's made by Covidien. Very, very popular for tracheostomy tubes. Number 5, when performing a tonsillectomy, which retractor will be secured to the Mayo stand? That is going to be your Crow-Davis. The other one that is sometimes secured to the Mayo stand, the one that is a closed circle, the Crow-Davis is almost like a C shape. The one that is a closed circle, that's the McIvor, M-C-I-V-O-R. Both of those are going to be secured to the Mayo stand. Okay. Number 6, during an open rhinoplasty, the surgeon has just asked for a 2 millimeter osteotome. Which of the following should the ST have ready next? That's going to be your mallet. We get to swing the mallet. Okay, number 7, when positioning the patient for a modified radical neck dissection, which of the following positioning devices should be available in the OR? That's going to be your shoulder roll, sometimes referred to as a scapular roll. Oh, going back to this really quick, the reason why we are doing this for radical neck dissection, you can kind of see it in the image here that I've placed. The shoulder roll is going to be placed underneath their shoulder blades to the best of their ability, hyperextend the patient's neck so you get a really good open access to the neck. That's why we use the shoulder roll, for hyperextending the neck. Wanted to make sure that I cleared that up. Number 8, which surgical prep solution is indicated for use during ear procedures? This is going to be your povidone iodine. The reason being, chlorhexidine gluconate, CHG, is contraindicated because it's ototoxic, and alcohol is also typically contraindicated. Povidone iodine is safe for use around the ear. They still will put a little cotton ball in there because they don't want anything to seep into the ear canal, but povidone iodine is going to be the surgical skin prep solution that is indicated for ear procedures. Number 9, comprehensive hearing tests will be performed by which medical health professional? That is going to be an audiologist. Number 10, which surgical procedure will be performed following the traumatic perforation of the eardrum? That is a tympanoplasty. Tympano and myringo both mean eardrum. Please know your med term for that. Number 11, when performing a transnasal transsphenoidal hypophysectomy, which gland is being removed? That's the pituitary gland. The pituitary gland is sometimes referred to as the hypophysis, so that's why we call it a hypophysectomy. Okay. Number 12, how is 4% cocaine HCl administered to the patient for nasal procedures? That is going to be via topical administration, usually with either 1/2 by 3 inch or 1 inch by 3 inch cottonoids. Usually it's 1/2 by 3, but at least 2 cottonoids each are going to be placed in the nostrils after they've been soaked in cocaine HCl. Okay, number 13, following an ear procedure, which dressing is most likely applied? That's going to be your glasscock. Number 14, during a tympanoplasty, the surgeon may harvest a graft from behind the patient's ear. This graft is temporalis fascia. And this is kind of the step-by-step imagery, how to harvest temporalis fascia. And it's because it is fascia from the temporalis muscle that covers the temporal bone. That's why they call it temporalis. It's the bone, the muscle covering the temporal bone, and the fascia is the covering of that muscle. So temporalis fascia. And then number 15, a stapedectomy may be performed to treat otosclerosis. Otosclerosis may cause the patient to suffer from, and we talked a little bit about otosclerosis and an overgrown Stapes foot plate, but I was very careful not to say which kind of hearing loss. This is going to be conductive hearing loss because what we are talking about with the 3 ossicles of the middle ear, that conduction of the vibrations, I was trying to give you guys a little bit of a clue there, that is going to not function properly. If the stapes is fused to the oval window, that conduction will either not work as effectively or at all. So that's going to be called conduction or conductive type hearing loss. Sensory neural hearing loss has to do with the cranial nerve, the cochlear branch of cranial nerve number 8, not functioning properly. Okay. We're now at the administrative and personnel review. So again, please answer numbers 1 through 15 using your test taking strategies. When I say pause, please hit pause, answer the questions on your own. Make sure you're using those test taking strategies like we have reviewed. And then when you're ready, we will answer the questions together. Okay, on the count of 3, 1, 2, 3, pause. Welcome back. All right, number 1, if the patient's illiterate, how will the OR team obtain a written informed consent? That answer is going to be A. The patient will mark an X. The witness's signature will mark that they validated that the patient's mark was their own. Can never sign a name for anybody else. That is not legal. And then you still have to obtain a written informed consent. So that's how they're going to do it, with an X, and then the witness validating that, yep, they saw them rake that X. These are some special considerations in obtaining informed consent. Please review these on your own time. Number 2, which organization is responsible for granting accreditation to surgical technology programs? That's very specific there. That's going to be CAHEP, the Commission on Accreditation of Allied Health Education Programs. I know we like to use the shorthand moniker, like saying CAHEP instead of saying that mouthful of Commission on Accreditation of Allied Health Education Programs. But knowing what these acronyms stand for is really going to serve you. So please, when you're reviewing AST, CAHEP, NBSTSA, TJC, that you don't just review what the acronym is. I want you to know what the acronym stands for. Please do that. And I have also added in all of the links for these organizations and a few bullet points on each organization. Obviously, that is limited information, so if you want more, please go to their websites on all of the services that they provide. But CAHEP is going to be the programmatic accrediting body of surgical technology programs. And then I have some more information on the others that we didn't choose as our answer, what the AST, Association of Surgical Technologists, performs or provides, what NBSTSA is for, and what the Joint Commission is for. Again, please review this stuff on your own, but if you need a little bit of information, you got it right here. Okay, number 3, areas in the surgery department that require the scrub suit, bouffant, and shoe covers. That would be designated as semi-restricted. So there is a difference. The unrestricted area, you can wear street clothes. Semi-restricted, you need all of the things that we listed, the scrub suit, the bouffant, and the shoe covers. Restricted area needs a scrub suit, bouffant, shoe covers, and the mask. That is the specific piece for a restricted area. Also sometimes referred to as a sterile area. So A and C are essentially the same. But restricted areas are going to be for OR suites or procedure rooms where sterile items are currently actually opened physically. So if the OR doesn't have any surgeries running and you've ever seen anybody in the OR that doesn't have anything open without a mask on, it should still be a restricted area. I'm not trying to confuse anybody, but that's the real distinction there between restricted and semi-restricted. It's to keep infection control as strict as possible for open, sterile fields. Okay, here is our access code for Module 9's PATH. Our access code is 430219. Again, our access code for Module 9 PATH Certification Review Session Week 9, 430219. Okay, let's keep going. Okay. Number 4, which ORT member is responsible for leading the lateral transfer? And that is the anesthesia care provider. And that is because they are responsible for maintaining the airway. Number 5, which of the following acts would be classified as an intentional tort? That's going to be libel. Libel falls under the umbrella of defamation, and libel is written defamation, slander is verbal defamation. Number 6, a patient complaining of postoperative pain went in for an x-ray. The source of the pain was from a Raytex sponge that was left inside the patient. Which legal doctrine best applies in this situation? That is going to be res ipsa loquitur. I always have to say that so slow, but that means the thing speaks for itself. Okay, and then these are all the legal doctrines and their examples, so please review. I know it's a little bit of Latin. Please review that on your own, what everything else means. The respondent superior, the premium non nocere. Please remember to review that stuff on your own. Number 7, according to Maslow's hierarchy of human needs, the highest level of individual achievement, that is self-actualization. And then here is the pyramid for you. Number 8, pediatric patients from 13 to 18 years will be categorized as which developmental stage? Those are adolescents. And then I have included the pediatric age groups for your reference. Number 9, which of the following perioperative professionals is responsible for performing imaging procedures and operating imaging equipment such as the C-arm? That is the radiology technician. Number 10, when was the first certifying examination for ORTs administered? That was in 1970. Know your dates. Number 11, which organization is responsible for monitoring the safety and efficacy of implantable medical devices? That is the FDA. The Food and Drug Administration. Under drugs, it's a big category of drugs. Medical devices do fall in there. Number 12, the timeout is included in the overall guidance for preventing wrong site, wrong procedure, and wrong person surgery, and that is known as the Universal Protocol. Number 13, which hospital department coordinates staff who are responsible for operating room turnover? That is environmental services. Number 14, a patient requires a craniotomy for an uncontrolled subdural hematoma. This would be classified as an emergency surgery. Please know the difference between top of the list is emergent. So emergency procedures, know the difference between that and an urgent procedure, and then also know what qualifies as an elective procedure. And elective procedures kind of have two categories in elective. It's for like quality of life purposes and then completely optional purposes. So just know those three categories and then know the difference in elective surgeries where it's quality of life and optional. I have that information here. And last but not least, the vertical advancement model utilized by employers to progress the career path of the surgical technologist. That is known as the clinical ladder program. And the goal of the clinical ladder program is found from the AST website. And you can click on that link down here if you want more information. Okay, thank you guys so much for coming. I hope you had a good time with me this quarter. I will always be available for questions, comments, concerns, and I will see you next time. Thanks for coming.